So, morning everybody. Can everyone hear at the back as well? Yeah. So lovely to be here again, and lovely to see familiar faces as well as new faces. So as Mark said, this morning I'd like to focus on something called the Toyohari system of meridian acupuncture. Toyohari basically just means East Asian needling. Hari is needle in Japan. Hopefully I'll be opening you up. I called the talk different ways of influencing the chi, and imagine all of you come from lots of different styles of acupuncture, in which case you will already know that there are lots of different ways of influencing the chi. And I'm going to, those of you who haven't heard of Toyohari before, hopefully will be opened up to a whole other way of working involving non-insertive needling techniques. I wrote an article recently you might have read in Acu, where I kind of started off by saying, you know, sometimes at dinner parties you've probably had people come up and say to you, oh, acupuncture, does it really work? You know, and you've been in practice 25 years and obviously feel a little bit insulted. So when I say, oh, I do a style of Japanese acupuncture that doesn't involve needling, they often say things like, oh, what do you do then? Do you just kind of wave the needle over the point or something? So hopefully I will be showing you and demonstrating that actually it involves something a little bit more detailed than that. So I came to acupuncture having studied TCM way back qualified in 1991, and then practiced TCM till 1998 when Stephen Birch, who you may have heard of, and Junko Ida came to the UK for the first time and did something called the Dr. Manaka Yin-Yang balancing system. I think a combination of both what I was introduced to as well as Stephen's teaching techniques meant that after the first weekend, basically that's all I started practicing. So that was kind of quite a testament that after, in effect, 10 years of what I was doing before, I completely changed. So obviously something talked to me at that time. A year after that, or a year and a half after that, Stephen and Junko did the first Toyohari meridian therapy training course in Amsterdam, which I attended and qualified in 2000, and that sort of took me off on a whole other journey. I've spoken before at this conference. Some of you might have heard me speak about Japanese acupuncture in general. I mentioned also in the talk this morning about some research that I did, which again, if anyone's interested in, I can kind of point them in the right direction about the kind of clinical effectiveness and outcomes of this style of acupuncture in a NHS GP practice setting, primary care setting. So I thought actually I'd start when I was thinking about doing this talk, you'll see I've kind of quote various members of our UK branch, just to kind of give you a little flavour from practitioners' point of view about why they do Toyohari and what they kind of get from it. But I also asked some of my patients, really just anecdotally, because sometimes we get feedback about their symptoms and how their condition changes, but we don't necessarily get feedback of how they feel when they're having treatment. So the little quote was, when I have Toyohari acupuncture, I feel a warm tingling sensation and a deep sense of relaxation and a feeling of coming back to myself. So I'm sure we've all had patients who kind of feed things like that back to us, but this warm tingling sensation is coming from needling that doesn't involve actually inserting the needle. So that's kind of quite interesting. So I'm aiming to sort of look at really how it is that we influence the chi, and what that actually means, and how do we even evaluate, or how do we know that that is what we're doing. So we're looking at basically a whole range of different types of needles, some of which are here at the front if anyone wants to have a look afterwards, and different types of needling techniques. We're also going to be looking at non-insertive needling and what that means. And also, hopefully, I'm going to demonstrate branch treatment that involves using something called zinc and copper on the skin surface to see how that actually influences and can change symptoms. So again, we're talking about really what goes on at the skin surface rather than necessarily deep inside the body, but we're obviously influencing what goes on deep inside the body. And how are we monitoring these changes? How do we know that we are actually making changes? And how can we assess that during the actual treatment rather than waiting for the patient to come back the following week and say, oh yes, my symptoms are better, or no, they're not. So really what I'm wanting to highlight is these very sort of different types of treatments, and just to sort of broaden out our kind of perceptions of all the different ways in which we do influence qi. I'm not an academic, although I did teach at University of Westminster as a senior lecturer for many years, and I'm also not a scholar or a sinologist, but I will be making some reference to classics because meridian therapy very much draws on classical theory. And so mainly I want to present this from the point of view as a practitioner, and also to really highlight some of the practical aspects of this system. We do have a little hidden or not so hidden agenda in that, and I will mention this at the end and put information up, and you will have had also a flyer in your packs. But we are running the first Toyohari program here in the UK, actually here in Reading at Kickham, at the college, starting in January. So that's quite a big coup for us because we have branches all through Europe, and this is the first non-Netherlands course that's going to be running here in the UK. So, developing sensitivity. As I said, as part of this preparation, I asked a few of my, well, I actually put it out there to the whole branch and asked them to tell me what are the things that, how they feel that Toyohari has developed them as a practitioner. So I'm not going to read all that out, but maybe you could just spend a couple of minutes looking at that and reading it through. So this is particularly comments that related to how they felt that it helped them in terms of developing an awareness and understanding of qi. So although I'm going to be talking also about how patients are affected and improve and, you know, the effects on them, I'm also in a way unusually putting it a little bit back on us as practitioners, because we always, a lot of our talks and things that we demonstrate are actually about what is it that, what's happening with the patient and how they're responding. And obviously that's very important because we need to make sure that our patients are improving and getting the complaints that they've come for to improve. But we don't really put a lot of emphasis on us as practitioners. And so this talk is also quite a lot about how we work as practitioners and how we develop our sensitivity. And this is something that you can take into all different styles of acupuncture. It's not, none of what I'm putting up here is totally unique to Toyohari. Some of the systems and styles and techniques are, but actually, I'm sure all of you have had kind of comments like that from patients and feel different things. So I'm not kind of taking the monopoly, or Toyohari isn't taking the monopoly of any of those things. So, core theories, talking about meridian therapy. I was just in Amos Ziv's talk this morning, if any of you were in there, and he was sort of talking about the different pillars of qi and basically about kind of classical Chinese acupuncture and the fact that we have a lot of emphasis on yin and yang and five-phase theory, and we have a lot of influence on Zhang Fu, and certainly that was my experience in TCM, although not so much on five-phase theory. It was just kind of mentioned as a little aside. But actually there was very little emphasis on channels, other than saying that obviously if you've got a pain in your elbow or on your arm, it's like, well, is it large intestine, is it small intestine, or is it triple burner? And we've got then qi and blood obstruction, stagnation in the channel. And that was really kind of pretty much as far as it went. Certainly in terms of practice, we got lots of theory. So what you'll see with the meridian therapy is that actually we're talking about just some very sort of simple concepts, which is kind of taking us back to really what acupuncture should be about, and is kind of really what we're practicing, rather than a kind of more herbalized prescription type of acupuncture. We're really focusing on how do we bring about changes in the meridian system, how do we get qi, and therefore qi and blood, to move, and how do we harmonize the different imbalances within the meridian system. And by doing that, hopefully allow the body to do its own healing. So we're not just aiming at symptom relief, but we want to actually improve the overall, what we call the seiki, or the global qi, or the overall kind of qi of the patient. And our main forms of diagnosis are actually I say simple, but we're looking at basically things like yin-yang. We're making assessments about where the areas of deficiency and where the areas of excess are. And as we know, yin and yang is fundamental to East Asian medicine in all its forms, and it's basically about how to kind of balance within that. So these are kind of things that, as we see, yin-yang can be totally in harmony, or it can be out of balance, and what we're looking to do is somehow bring that back into some sort of cohesion within the system. So yin-yang is central to meridian therapy, and so is five-phase theory. So having, can't see what the thing is. So as I said, when I did TCM, 5 phases was kind of just mentioned, but wasn't really particularly used in terms of practice. So I thought that actually, because I'm describing a system that actually was originally developed by blind practitioners, it would be quite helpful to just give a very short, brief, potted history, just to put it into some kind of context. And also in terms of, as we know, East Asian medicine's been around for 2,500 years, and during that time there's been lots of influences, both culturally and obviously in different countries as well. Different aspects have been brought to acupuncture, and certainly if I think about what was around 27 years ago when I studied compared to what's around now, it's unrecognizable in terms of the range of ways in which we're being exposed to so many different systems of acupuncture. So really the key things to sort of point out within this is that there were basically big kind of changes around the time of the Meiji Restoration, particularly around sort of 1870 onwards, where sort of end of the 19th century, beginning of the 20th century, where there were obviously influences of Dutch involvement and particular texts that were translated, and a general move towards wanting to incorporate Western medicine and Western medical kind of influences. And this was then adopted by the government, and also lots of restrictions were put in place. So actually only medical doctors were allowed to practice herbal medicine, and only medical doctors or blind practitioners, strangely, were able to practice acupuncture. But by the beginning, early time of the 20th century, lots of forms of traditional acupuncture were banned. And so we were moving very much more to this very medicalized form of acupuncture that would be kind of acceptable in terms of Western medicine. As I say, to begin with, what happened sort of in that early sort of stage, the government actually made a sort of strategical error in that they started to allow sighted people and non-doctors to practice acupuncture. And of course these people were able to read traditional texts and basically start to kind of incorporate them and think about, how they could apply them. And so even though there'd been this kind of banning of traditional acupuncture, and that actually this meant that traditional acupuncture in Japan was almost dead, it meant that actually there was a wave that started, which was about basically in the 1950s, and also after 1948, when MacArthur was in charge, acupuncture and also lots of things were licensed. So whereas unlike in China and different kind of places, all these different things had separate licenses. So that's why we have such a tradition of moxibustion practitioners and a whole treatment just using moxibustion. So I know that I've got two people in the audience, Philippe, who's going to be doing a whole session on moxa and Japanese moxibustion, and Merlin, who's going to be talking about the effects of moxa and Mox Africa charity in particular that's been working in Africa and basically showing really the power of this very sort of simple but powerful technique where you can affect people's outcomes in terms of TB and reaction and response to medication, but also in terms of what Paul was talking about if you were in the lecture this morning about sustainable medicine and how we can actually influence that and what we can bring to the table. So watch the space later on for those two speakers. But anyway, going back, 1950s, really there was this movement of Keiraku Chiryo, which is meridian therapy, and it basically started to sort of, it was a bit of a backlash, saying actually, you know, we've got all these amazing kind of theories and things, and we don't want to lose them, so we need to kind of bring them back into our sort of medical paradigm. A little bit in the same way as there was the Zhongyi movement in the 1920s in China. So there were lots of parallels and also kind of differences that were going on. So this goes back a long way, but somebody called Waiichi Sugiyama actually started the first blind school back in the 1680s. And those of you who use guide tubes, many of people use guide tubes these days, particularly if you like using thinner needles. It was actually developed originally by Sugiyama, who kind of in a dream, he had this, you know, dream that he really wanted to be an acupuncturist, and he always wondered how it was going to happen. And in the dream, this guide tube kind of vision appeared to him, and realized that actually if he could develop something like that, then he would be able to actually have some kind of control and influence in terms of needling, although needles probably weren't that fine in the late 17th century. So, as a result of this wave of meridian therapy and Keiraku Chiryo, the Toyohari Association was formed. And by the 1960s, this group basically had developed their own methods because they were blind. And so they were adapting this kind of theoretical system, but to blind practitioners, and that continued to develop through study groups and through their own kind of association. And I'm going to talk later on about Kosato, because the Kosato method of practice is absolutely central to Toyohari. Oh, I don't know why that popped in there. But anyway, Kodo Fukushima, he was the original founder. So these are some of our blind practitioners, esteemed teachers who we get to meet, some of whom sadly are no longer alive. One in the top right-hand corner is Takai Sensei, who was the president when I first started, and Yanagishita Sensei, who was the previous president. Both of those sadly have passed away. But we get to work with these teachers and many others every year when they come and visit us in different countries in Europe. So, key characteristics. As I mentioned, diagnosis is very simple. We have very few patterns, and you might wonder how on earth do you treat all your patients with just, in effect, 4 patterns, but then within that there are lots of variations and different kind of elements to it. We use 4 diagnoses like you would in all your other systems, to do with looking, asking, touching, and I'll go into that more. And we use that to identify what we call the pattern, the show. So touching diagnosis is key to that. Obviously, if you're coming from a blind tradition, touching and palpation are the skills that you particularly have really kind of developed and harnessed. So we get a chance to really learn from teachers who rely on touch more than anything else, as well as listening as well, and general feeling of patients. So, as I mentioned before, we're talking about very gentle, subtle needle techniques, but we're applying these techniques rooted very much in classical texts of the Neijing and the Nanjing, and I'll go over that a little bit later on. So we're using very fine needles. 0.18, I think, is number 2. And they're silver needles, particularly for tonification, because their silver is very soft as a metal, and because we're not inserting it. So, the other thing I really liked when I started in Toyohari, and also actually the Manaka system, is that sometimes one can get very lost in a treatment that you're formulating for a patient. And with these systems, it's very structured. So you have a step-by-step approach to how you work through from the beginning to the end of a treatment. It's also quite a lot more work, because unlike what I used to do before, where I'd stick the needles in and then you can either sit in the room and read your journals or go and make yourself a cup of tea, we're actually working all the time, because we're constantly adjusting what we do through the treatment. It's not like we decide at the beginning. I mean, we do decide at the beginning because we have a diagnosis before we treat, And then once you've got the diagnosis, the treatment kind of follows diagnosis, and then within that there are variations and lots of different decisions to make. But actually, what you're doing is you're adjusting the treatment all the way through based on what you're picking up on the pulse and other information. So it's not like at the beginning of your treatment when you finish the consultation, that's the end of it. It's a dynamic process of interaction all the way through with your patients. So, but within that structure, we always do, and we start generally with something called our root treatment, Honshiho. So in TCM or Chinese medicine, we talk about the Ben and Biao. This is sort of applied in quite a different way, in that the root is very much about how do we regulate the meridian system, how do we bring about balance within the meridian system. And the branch treatment is how do we bring about relief of symptoms. So they're not separate, but they're different techniques. Sometimes we don't even do branch treatment, either because a person is very sensitive or because actually there's enough change that's been brought about just through the root treatment. But depending on how skillful you are or how confident you are, we do have a whole range of different branch treatments. And again, I'll sort of talk about those later. But again, even the branch treatments are very much about identifying what's going on within the meridians, which ones are excess, which ones are deficient. So, core theories, we're just really on a very kind of simple level looking at the interaction between the Zangfu, the internal organs, the channel system, and also what we call Seiki or Zengqi in Chinese, basically looking for some kind of integrity within the system, a kind of an idealized kind of state that probably even babies aren't necessarily in that state, because we're all born with certain kind of constitutional special influences and predispositions. But that's kind of what we're aiming for, and even just picturing that in our mind is quite helpful. So what we know in practice is that actually we have this more, that we have basically either something that's internally out of balance that then reflects and manifests on the meridian system, or that we have external outside influences that start to compromise the meridian system, and if those aren't treated, then they can affect also the internal organs. So the general principle when we're doing root treatment in Toyohari meridian therapy is an understanding of that actually if everything is intact, then we don't get ill. And actually when there are these kind of compromises to the system, that's when we're more vulnerable. So whether you believe in germ theory or different kind of approaches, wind-cold invasion or whatever, we know that not everybody gets sick exposed to the same environment. And one of the ways of explaining that is that if somebody's qi system is in some way weakened, then they're going to be more likely to get ill than somebody else. And that doesn't have to be over a long period of time. It can just be something like not having slept well for a couple of nights, or suddenly having a very stressful week, or overworking one week. All those things can affect our qi and the integrity of the system. So patient after treatment functions, basically we're looking to get back to this place. And I'd just like to kind of give a little example of, I guess, you know, again, this thing of how do we assess that we are making a difference. And I recently had this is actually coming more from Shonishin, which is something else that I practice, which is pediatric Japanese acupuncture, also using very gentle stroking, tapping techniques, some tools I've got there, non-insertive needling. And I treated a little girl, toddler, who has very severe cerebral palsy, and she's being fed through a tube into her stomach because basically she can't digest and certainly can't swallow. And the mum brought her for treatment, basically she brought her just for one treatment. In fact, I'd been treating the mum who came just right in the middle of her IVF treatment, incredibly stressed out. But she brought her daughter, and we did a very gentle Toyohari Shonishin treatment, and then also did root treatment using meridian therapy, using one of our kind of what we call teishin, which are even more gentle needles with a rounded head. And I was able to just do whatever I could do because she was moving around quite a lot, and her mum was having to hold her. And she wasn't able to bring her back for about a month, so because they were so busy and they have so many appointments and the mum works. So I basically showed her very, very simple stroking down the meridian techniques using, in fact, a silver spoon, because that's what she had. And when she came back, obviously a month later, it was quite a long time between treatments, I asked her, how is she? And she said, oh, well, she's not really any better. The reflux is really bad. It's been, bad at night time. And as usual, it's kind of keeping us awake and I'm exhausted. So I thought, okay, all right, not much change. And I started treating her, and she said, because I was commenting, I think, on, the fact that she had kind of good color. She said, oh yeah, she said her complexion's been really good this last month, and her skin quality feels really, really, much, much better. And she's really much jollier in herself, and she doesn't seem to be catching cold. She's always catching everything, and she doesn't seem to be catching these. So I went, oh, okay. So you've probably had this experience where people kind of say, oh yeah, nothing's changed, and then when you start asking them, you suddenly realize that there are lots of other things that have changed. So I said to her, look, you've been doing a really, really good job with the work that you've been doing in the last month, because actually for me, these are all signs that what we call the Seiki, the global chi, is actually improving. Her complexion's improving, the skin quality is improving, and her general overall well-being is improving. So we haven't made a difference, and I'm not sure if we ever will in terms of the reflux, but certainly that improved. And at that second treatment, she said, oh, I'm not quite sure what you're going to be able to do, because actually she didn't have her lunchtime sleep because she got woken up by the sirens of an ambulance, whatever. And so I could see she was kind of quite grouchy, and, I thought, well, I'm going to probably be able to do very little. And I just did, again, a little bit of stroking, root treatment with the teishin on the points that I could actually get to. And 5 minutes later, she was kind of just completely blissed out on the table with her arms out to the side. And her mum said, well, that's kind of her most relaxed state. So there are kind of different ways, I'm using that as an example of saying there are different ways of being able to kind of assess what it is that's changing and whether we are making a difference. So, as I said before, we're looking at very structured system of treatment. And the first thing that we do, this is just an overview, and then I'll go into things in a little bit more detail. We're looking at the 4 diagnoses, which should all be very familiar to you. We're looking at making a selection of a pattern based on that, and based on which we see as being the weakest meridians. And then based after that, as I said, there are very simple treatment patterns in terms of what we do. So when we know we have a lung pattern, we know which points to use, but then within that there are also variations depending on other information that we get from the patient. We also pay a lot of attention to dosage, and again I'll talk about that later, in a way that certainly when I was at acupuncture school that was never mentioned. So I know obviously if you're herbalists then you pay a lot of attention to dosage, and that's key to deciding what it is you do, but certainly in terms of acupuncture that was never mentioned. So that's quite important in Japanese acupuncture, assessing the patient, assessing what is the right dose of treatment, not too much and not too little. Prognosis is also part of that, and that's part of also a kind of assessment of the chi and what can somebody, how we think somebody's going to respond to treatment based on that information that we gather from all of those diagnoses at the beginning. And then finally, before we even treat, we have to think about what we're going to use in terms of types of needles and what type of needling technique we're going to do. So there's lots of different, within this very simple system, there are lots of kind of decisions that need to be made. So looking diagnosis, we're basically, soon as somebody walks in the room, you can start making an assessment about how this person looks. You know, sometimes we're really hit, aren't we? Maybe even somebody who we've known and treated, and suddenly they come in and they don't look like they did before, either because they look kind of a lot weaker than normal, or maybe they look a lot better and a lot more robust. So we're looking at the overall cure, with the weakness and strength in terms of their appearance. But we're also looking at the colour, particularly around that kind of lung 5 area below the elbow, and also at the abdomen, maybe just those very obvious areas that look excess or sort of deficient. We try to make assessments about somebody's, the sound of their voice, the tone of their voice. We use that more for prognosis rather than diagnosis. So it may tell you that, oh, that person's got a very groany voice and that's maybe kidney related, or they've got a very singing voice and that's spleen related. But we don't use that predominantly for making the diagnosis, but it can tell you whether the system is more in cohesion or not. So if you've got lots of different signs and symptoms that relate to lots of different meridians, telling you there are lots more that's out of balance, that tells you that maybe prognostically it's going to take a little bit longer to treat than somebody where all the sort of signs and symptoms kind of, not so much necessarily textbook, but actually all support the same areas that are affected. Smelling is not my strong point, particularly people come in with usually about 10 different, if I think about myself, about 10 different products that they've put on their body that day. But sometimes you do pick up a very unusual smell or particularly strong smell. And even that tells you then something about pathology. If somebody comes in with a very strong smell, even if you can't diagnose what that strong smell is, it's telling you that there's something that's maybe pathologically going on more than somebody where you can't really pick up anything. And then, as usual, we take information about the presenting complaint, various other, what some of you might know of as the 10 questions. But all of the time, what we're doing is basically looking at how those affect which of our meridian systems, whether it's more spleen related, whether it's maybe more liver related, what kind of meridians particularly look like they're kind of out of balance. So touching diagnosis, channels, we're assessing to see which meridians are excess and which are cure, and generally the overall condition of the patient. So what I'd like you to do now, just for a couple of minutes, is first of all just access your own forearm and just very lightly stroke down your arm and just get a sense of how does it feel. You may never have done that before, or you may have used more on the outside when you put creams on things, but I just want you to just very, very lightly, so we're not using any pressure, but just stroke along that arm and just get a sense of how does it feel? Is it more puffy? Is it more firm? Is it a little bit moist? Is it cold? Is it hot? Just generally, what do you get a sense? Ideally not through your clothes, but directly on your arm itself. Very light touch. We're talking about almost as if you were kind of wiping some dust away initially. You're just feeling what's going on the skin surface. And now I'd like you to turn to your partner, somebody next to you who maybe you don't know. So say hello first and just touch each other's arms and get a sense of how does that feel. Because it's a bit like when you do tongue diagnosis, you know that everybody's tongue is completely different. So I'm not asking you to make any diagnosis, but just observation. What is it you're feeling? Would you say this person's arm are they going to live? Is their person arm more cure, more deficient, or more jits? So you can, coming back to the front, just we always do, try not to spend too long on anything, just to get a first impression. So Japanese acupuncture is very much influenced also by, okay, can we come back to the front now? Everyone's getting very involved in their practice session. Can we come back? Sorry. Hello? Ding, 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 ding. See, look, you're all getting very involved already. I love it. However, I've got a little bit more I need to say before the end of the session. So, blind practitioners, Anma, massage, all these things really have put palpation very much at the heart of Japanese acupuncture. And Mark mentioned that I did shiatsu. That's kind of how I got into East Asian medicine. I lived in Japan. I'd done some evening classes in shiatsu in London, arrived in Japan and was teaching English and thought, oh, I could do some more shiatsu because I'd done some in London and loved it. And so I was studying shiatsu with some individual teachers, and that was it. That kind of, having started out with a law degree, I knew I didn't want to do that. And shiatsu kind of started me on the road to studying East Asian medicine. Came back to the UK to study, so it was very appropriate that 7-year cycles after qualifying I then got exposed and back to Japanese acupuncture, and also particularly abdominal diagnosis, hara diagnosis as it's known in shiatsu and acupuncture terms. So again, I won't get you to feel each other's bellies at this point, you don't know each other quite well enough, but we are looking, when we're touching, also at areas. There are different areas on the abdomen. I'm not going to go too much into all the individual sort of areas and things, 'cause it's too much information, but really different parts of the abdomen relate to the different organ areas. So you can imagine that around the navel is the spleen, and then the lower abdomen, right down the middle, is going to be kidney, and up here is heart, and then we've got the liver and the lungs. But we're just looking, again, through assessment, which are the areas that feel the weakest, which are the areas where it feels maybe a little bit excess. Imagine if you felt Ren 12 after you've had a meal, you're going to feel that it's going to be a little bit more jits, a little bit more excess rather than deficient. And then finally we come to the pulse, and pulse diagnosis is kind of key also to making our diagnosis. We're looking mainly at the strength and the depth and the speed that tells us a little bit, well, quite a lot about how the chi is moving. And so that's not only key to the diagnosis, but it's also our main feedback tool for treatment. So this is, we'll go back into this a little bit later about how is it we're actually evaluating what it is we do. And using the pulse is kind of key to that at all stages of the treatment. So, as I mentioned before, maybe when you were looking at each other's arms, you were picking up on certain things that tell you that maybe things are a little bit more kyo, a little bit more deficient. So if something's a bit soft, depressed, moisture very much tells you that the pores are slightly open, that you have to be careful how much treatment that you do. And then these jits, more excess findings, maybe if there's an area that has pressure pain, that sort of thing, a little bit swollen, a bit hot in comparison to other areas that are very cold. So you can, even if you aren't doing meridian therapy and you're a TCM practitioner, you can start feeling the abdomens of your patients and just getting a sense of how does it feel below the navel, how does the upper area of the abdomen feel compared to the lower abdomen. You know, are there differences in temperature? You know, it gives you information, even if you're not thinking about it the way we are in terms of guiding you towards treatment, but it's useful information. So, as I mentioned before, pulse diagnosis, we're looking basically at assessment of these kind of key areas. We also look at if there's hardness on the pulse. We're looking at the width of the pulse. We're looking to basically improve the overall quality of the pulse. And when we do needling, these are the areas that we want to improve. So if a pulse is particularly rapid, then obviously the aim is to try and slow the pulse down. Obviously rapidity can indicate that there's maybe some kind of heat in the system. If it's floating, then it can tell you that there's disturbance at the chi surface, particularly also on the yang level as well. And strength obviously is going to tell you about the quality of the chi. And then in terms of making a diagnosis, we're looking at the different pulse positions and basically trying to establish, particularly the yin deeper level, which are the meridians that are weak and which are the ones that are excess. So fundamental to meridian therapy, Keiraku Chiryo and Toyohari, is Nanjing 69, which basically says that we always supplement before draining. And that is the key to our root treatment. That's the first thing that we do when we're doing a root treatment. Obviously, when there's deficiency, we not only supplement the main meridian, but we also supplement the mother, because as we know, we have to tonify the mother to support the child. So the primary pattern is always a deficiency pattern. And if you come from a TCM background, like I originally did, that would be a bit like, well, if you've got some kind of external invasion, that's a big no-no. You never tonify. You have to clear the exterior and clear the pathogens. But as I said, in meridian therapy, there's an understanding, if you go back to that diagram of all the different levels, if you've got some kind of external invasion, that's there for a reason. And it's there because there's some kind of underlying weakness. So we support that underlying weakness in order to then clear what we call the pathogenic chi, or the shie chi, or jaki in Japanese. So slightly different way of looking at things, but basically that's always the first part of a root treatment, that we're tonifying. And in fact, what you find on the pulses is that if you actually do a very good root treatment at the yin level, you're actually bringing up some of that jaki that we identify on the pulse in order to be able to clear that. So you're still clearing within the same treatment, but we're actually not starting out with clearing, we're starting out with supporting that underlying energy. So this is, I'm not going to go through all the different patterns. It'll get a little bit boring, and also at this point it's not really that relevant. But just to give you an idea, very simply, basically, that if you're doing something like a lung pattern, then both on the abdomen and on the pulse, you're looking for weakness within the lung and the spleen, because the lung pattern is lung as in metal and spleen as in earth, the mother meridian. So we're on the right hand proximal and middle pulse. Sorry, not proximal, distal pulse, lung pulse, and spleen pulse, metal and earth. We would expect that to be the weakest out of all the different meridians, and also correspondingly on the abdomen. So this just gives you a little bit of a kind of overview, that basically what we're looking at, as I said, is this very structured approach to treatment. We're always starting off, as I said, with the primary pattern, and this is always on what we call the sort of nourishing cycle. The Sheng cycle is basically on 5 elements. We're looking to see which 2 patterns are the weakest. But as I said, it's very step-by-step approach. And the second pattern that we treat is on the controlling cycle. So when lung and spleen are weak, and lung is the pattern, we're looking to see what's going on in the liver and what's going on in the heart, which are the 2 controlling cycle meridians that are affected, particularly by the lungs. And in Japanese acupuncture, there's a kind of basically a general thing of not treating the heart, and we treat it indirectly through the pericardium. So in effect, if you have a lung pattern, we're mainly talking about looking secondary to see what's going on in the liver. But even if we think there's something going on in the liver right at the beginning, once we've treated lung and spleen, only then do we really decide what's our next point that we're going to needle, because it might have changed. And it may be that what we call something called okijits, where actually the balance has come about. You've tonified the lung, and actually it's now controlling the liver, and liver doesn't need to be treated, or liver is now been balanced out. However, if we still feel that there is something going on in liver, then we treat it. But that decision is only made after we've treated the first part of the root treatment. And then after we've done that on the controlling cycle as well, we then move on to what's going on the yang channels. And this time we might be tonifying, or we might be dispersing. If you've got something like, a cold or a sore throat, you would hope that maybe you're going to find some kind of jaki, some kind of pathogenic chi on the large intestine. But we don't just disperse large intestine because we know that the large intestine meridian goes up to the throat. We only treat it if we feel it on the pulse. So there has to be some kind of hardness that is there at the yang level on the pulse before we do treatment. So it's not theoretical, it's totally based on what we're feeling when we're checking the pulse. That's why it's so important, because as I said, if you do a good root treatment, that jaki, that pathogenic chi, can come up more to the surface, and you might not have felt it at the beginning. So, branch treatments, we have a nice big array of options. We have something quite specific, I think, to Toyohari called the naso and muno area. And traditionally it was called stomach 12 area and stomach 30 area in the lower abdomen, in the groin area. But actually it covers a much wider area. So the naso area is the whole of the neck. In fact, I'm going to show you a little video a little bit later. And then also the muno area. And if you think about these are the gateways for all the meridians that are coming up from the leg, up into the torso where all the main organs are, and also where the channels come down from the head, also down into the organs. So they're key areas of junctures where energy can get blocked. And we have lots of different techniques for identifying what we're feeling on those areas and different ways of treating them as well. And in fact, when I was just in Lisbon last week at our annual Toyohari workshop with the teachers from Japan, and they're always refining and bringing new things for us to try out. So this time we were actually looking, rather than just treating, obviously we treat directly findings in that area, again with non-insertive techniques. This time they were saying, okay, well, let's needle a point here. I say contact needling, not actual needling, and then just assess what's going on in the back and see how it changes. And of course, you know, you do a very light tonification point here, and suddenly the back around the bladder area has completely softened and changed. So they're always refining and giving us new things to try out. Kike is the one I'd like to demonstrate, and that's basically uses of zinc and copper on the extraordinary meridians to directly affect symptoms. We also use something called the midday-midnight cycle, which again I learned in acupuncture school around, you know, different meridians through the 24-hour clock that peak and trough at different times. But I never really learned how to use them in practice. So it's a very interesting way in which we use it within Toyohari. Direct moxa, obviously if you've got blind practitioners, they don't do direct moxa, you'll be pleased to know. But they often have assistants and people who work with them who will then do moxa. Very much, I talk just on moxa alone, and I'm sure those two people over there will be later, but obviously we're also then talking very much about influencing at the blood level, not just the chi level. And Amosiv this morning was talking about what's chi level and what's blood level, and obviously any time there's anything chronic, then we know that we're not just talking about something at the surface, but actually things have really become changed pathologically at the blood level. So things like Oku direct moxa, Shiraku bloodletting. Again, Emosiv was talking about the Jingwell points. We have lots of different techniques, how we do very, very gentle bloodletting, where you literally are just squeezing maybe 1, 2, or 3 drops in order to sometimes bring about quite dramatic changes. And then Sanshin contact needling, where you're just working over a whole area to bring about an improvement in the chi and the quality of the chi. So, as I said before, what is it that we're looking for? How do we know that we're making changes? I gave the example earlier of the little girl with cerebral palsy that I was treating. But how do we know what is it that we're actually looking for? So, as I said, we're always using the pulse, not just to help identify the pattern and to tell us about the pulse quality, but how do we want that pulse quality to change? So if somebody's got a very weak pulse, we would like that pulse to get stronger. If the pulse is very wide and open, then we want to consolidate it to get a sense of the walls of the artery. And if the pulse is very sinking or very floating, we'd like it to kind of come back to the middle. And depending on what styles of pulse diagnosis you do, if you have a big difference between yin and yang, between, say, lung and large intestine, that's also telling you about what imbalances there are. And ideally, we want to kind of bring that back together. I think one of our teachers talked about making a kind of really good quality hamburger, where you're kind of bringing everything back to that kind of middle pulse position in terms of the roll at the top and the roll at the bottom, and the hamburger in the middle being the middle pulse, and just really wanting to kind of consolidate the pulse in terms of yin-yang levels as well. So we're assessing this after each point. Every time we needle a point, we go back and check the pulse to see how it's changed. We're looking at abdominal changes. Maybe there's better luster. Maybe they've taken a nice deep breath when you've needled, and maybe the channels have improved as well. That hopefully we're looking for a better quality of luster, and improvement even to things like complexion, or if somebody's very flushed, maybe they start to get a little bit less flushed. In general, overall, we want everyone to relax because then we know that different aspect of the nervous system is being engaged when you get somebody to feel kind of better in themselves. So, choice of needles. As I said, we use just very fine silver needles for our main root treatment. But if somebody's very sensitive or a child, we have a whole range of what we call teishin with a little round head. And we have lots of different shapes and sizes and thicknesses and lengths and different metals. So you can get pure gold ones, you can get pure silver ones, you can get 5 metal ones, titanium ones, platinum ones if you're particularly wealthy. Anyway, I've got a few there, and also the what we call the zanshin and the enshin, which are the ones that we use either to gently sort of tap or rub on the meridian. So this is things I'd use more with children, but sometimes I have teenagers who are just, if you've ever treated teenagers, absolutely solid. They can't read anything from their abdomens, everything absolutely rigid. Sometimes actually starting with doing some very light rubbing can actually help everything to relax a little bit. So recently I've also been doing some work over at Grenfell, and I visited some people in the actual hotels where they've been put up for rather too long. And there was one woman who I worked with who basically, just feeling her skin incredibly puffy, incredibly weak. And I wasn't able to use Moxa because I was squeezed this treatment table into one corner of the room with the smoke alarm right underneath it. So I thought even direct Moxa, I thought maybe I'm not going to risk it. So I was going to just do some very sort of gentle treatment on her. And actually, I ended up, I didn't even use a silver needle, I used the teishin, and I couldn't do any sort of local treatment because even touching her, I could just feel that I almost couldn't touch her. So I used literally one of these tools here and one of these tools here, and big changes both in terms of how the skin felt and also her problems with her elbow and specific things that she had. So we really have to adjust what we do and how we do it based on how we find our patients and what tools we use. So touch needling, as I say, we use these round-headed needles, and dosage is really important. So that's an example of what we don't want to have happen to our patients. So at each stage of the treatment, we're gauging what we're doing. If the skin starts to feel moist, that tells us we've maybe done too much. If the pulse loses consolidation or new symptoms develop, suddenly somebody develops a headache or something. So we're always looking to kind of gauge that. So, just briefly, I wanted to just give a case. I actually want to, I'm not going to spend too long on it, so I've kind of laid it out the way we lay it out in Toyohari when we present a case, where we have to present it at all the different sort of stages, describing how we came to our diagnosis, what the information was, what we did, and how things were. So I'm going to race through this a little bit, but basically it just gives you an idea of how that kind of structure, in terms of how it comes together. So this is somebody I treated a while ago now, female, 42 years old. She came for fertility. I'd luckily successfully treated her sister, and she'd had a previous miscarriage not very long before. So as I say, we'd take all this information down. She was looking kind of quite tired, quite a little bit lusterless. Everything looked a little bit dry. Her hair looked a bit dull. Complexion was quite dark, and under the eyes. I look at the tongue, because even though we don't really use it in meridian therapy as a original TCM practitioner, sometimes it does give me useful information, even if it's just for things like dietary advice. So slightly deep voice, groaning voice, no obvious smell. She'd been trying to get pregnant. She'd had a miscarriage only a few weeks before. Had had no previous pregnancies, and still hadn't had a period, just early days yet. Usual kind of 25 to 28 day cycle. So nothing hugely kind of standing out. Sometimes some pain, aware of fertile mucus. Generally she had quite good energy. She hadn't been sleeping very well recently. Lots of emotional things coming up, just around not having got pregnant, having had a miscarriage. So a few little bits and pieces. Generally she was more hot rather than cold. generally tends to some dryness, not much of a medical history. So again, as I said, we look at the channels. So I was looking at particularly kidney and the lung channel looked depressed. It was weaker in the lower abdomen, but also in the liver area. And the overall tone wasn't too weak. It was kind of quite reasonable tone. The pulse was quite weak, a little bit on the slow side, and quite deep. And a number of different meridians felt weak, but the kidney felt the weakest. So I was kind of thinking it's going towards a kidney pattern, but could also be a liver pattern where kidney and liver have to be weak. So you break down ideally in terms of the different signs and symptoms. Obviously in terms of her age and fertility things, we think about the kidney, but not exclusively. She had particular frequent urination. She slept quite lightly, woke up early. Those are kidney signs in meridian therapy. And various things that all pointed to kidney being the most imbalanced. And then you can see skin we think of in terms of lungs and the emotions. So we kind of try and break things down just to get an idea in that way. So in terms of diagnosis, most of the signs did point to a kidney, possibly secondary spleen pattern. But on the pulse, liver was also a little bit weak. So sometimes we do clarification on the abdomen and we do just excuse me, gentle tonification, again, not inserting the needle on REN 12, REN 6, stomach 25, for example, and that often helps to clarify the pulse. So you could be, if you're even unsure in your own systems of acupuncture, sometimes you can even do just a little bit of cone moxa on those 4 points, and you'll see that the pulse comes up and it can help to clarify the pulse. So I treated a kidney pattern because after the clarification it became clear that the kidney was the weakest one. And that's the key points that we use for a kidney pattern. So we do the tonification point, and normally we do the Harari point, so that should be lung 8, but often in Toyohari they found that lung 5 is more effective than lung 8. So it's like with lots of these things, you know, we have hard theory, and then we have empirical evidence that tells us, oh, actually something else works better. And on the Sokoku, the controlling cycle, spleen was weak, so we did tonification. We also make decisions about side of treatment and whether we treat on one side or the other, which side, and then the controlling cycle is on the opposite side. And on the yang channels, everything felt a little bit weak, so triple burner 4 is the source point of triple burner, a big yang tonifying point. I did tonification and just gentle light tonification on the back, on the supporting root treatment points. So second treatment, she did actually, so I didn't do any actual treatment specifically to address symptoms or anything. I was just working on the root. She did feel lighter, emotionally on a more even keel, still hadn't had a period. The same pattern seemed obvious, and I just did some light tonification on that area of the neck because the skin felt a little bit lacking in luster. So third treatment, again, feeling better in herself, less foggy, less heavy. Her period started, and she was looking to have IVF treatment if things hadn't improved. I then also did Kike treatment. There was sort of some disturbance in the abdomen. I'm not sure, that was, I think the period was still happening. So I chose spleen 4 and pericardium 6, which also, as we know, is Chongmai, but also because of where the meridians run in the abdomen. Also, they often have a calming effect with the pericardium point. She mentioned a headache, and you can then start thinking, okay, was it the wrong pattern, or did I miss something on the yang channels? So just kind of noted that down. Basically, what was interesting is that her pattern didn't really change. So she carried on as a kidney pattern, and then I slightly varied what I did. So for example, on this time I did a different needling technique on a different spleen point because there was some disturbance on the pulse that indicated there was some stagnation in the spleen meridian and also on the abdomen. So we vary. We're not always doing the same points, even if we're doing the same pattern. For Kike, I did kidney 6, lung 7 to support the root treatment, and just did some light qishin, like light retained needling on yin tang, nice calming point, CV4. So again, just carrying on really, a bit like before, except here she'd had some sore throat, some sneezing. I think she'd had a lot of stress at work. And so this is where we then vary the points. I'm still doing a kidney pattern, but I'm choosing the metal points, because according to Nanjing 68, if you've got things like chills and fever or cough, things like that, we choose metal points. Yeah, so there's an understanding that actually all these the source, not the source points, the what we call maybe command points, or the points that are related to particular the 5-phase points, they all have the same quality. So metal points are used when there's cough or when there's chills and fever, in the same way that if you had joint problems and heavy achiness in the joint, or some sign of what we call dampness, you might think about using the earth points. So we can vary what points we choose to do. And also what appeared then after I did the root treatment is that large intestine had some pathogenic chi, so we did a dispersion technique. So carrying on, as before, just trying to think anything else. Different again, tendency to this respiratory things. I did the metal points again. I did Kike treatment with her. You can vary the polarity depending on what brings about the best pulse change. I did Moxa on GV14, which is very good, particularly when there's a lot of disturbance on the Tai Yang level, and bladder 12. And she was visiting the IVF clinic. She was very impatient to get pregnant, so even though she'd been told to wait and everything, she was already kind of going down that path. You can see I did something else. I think she had some sort of stomach upset, so I did an extra point with Moxa under the foot that's specifically for food poisoning. Mainly I was doing root treatment with her, and Sanshin, very light sort of contact needling on the back. 9th treatment, luckily before she went for IVF, she was pregnant, and actually unusually didn't come during her pregnancy, but had her baby 9 months later. So it's not a particularly complex case, and actually what was interesting prognostically, the fact that her pattern stayed pretty much the same was a good sign, because it showed that actually there was lots and lots of different disturbances within the chi system. But in terms of what I did and what needling techniques, it varied based on what I felt, particularly on the pulse and then also her symptoms. So I'm going to get you to, so just a couple of little things. So prognostically, as I said, generally her hormone levels weren't too bad. And a lot of the signs and symptoms were consistent, and that kind of indicates a good prognosis. As I say, I did question sometimes when she had these headaches, whether maybe it was a liver pattern or whether I'd missed something on the gallbladder meridian. And, you know, the fact that she then came down with a cold, had I done too much? You know, so we look at all these things about have we over-treated, what are the things that are bringing about particular changes. But actually, needling kidney 7, needling the kidney pattern did bring about good pulse changes, so I didn't get kind of distracted by going off and doing different patterns. Before I get you to do something a little bit, so we, as I say, so we're doing all this non-insertive needling, but actually we've got a lot of very complicated needling techniques that we spend years refining and developing and improving on our skills. So we have a basic ho-ho pattern, pulse that I'm going to, needling technique that I'm going to describe in a little bit more detail in relation to the classics. But we have lots of different things that we disperse. We have something called a generic Shaho technique, where we're doing a dispersion technique, but we also have 3 different techniques for when we feel that an overall meridian is weak, but within that meridian there's just a little bit of jaki, a little bit of pathogenic chi. And based on what we're feeling on the pulse, we choose our needling techniques. And also a decision about whether the problem is more at the yin level or more, at the chi level or more the blood level. Before we can needle, though, we have to find what's called the actively alive point. This is a quote from actually a moxibustion specialist, where everything in moxibustion, Japanese acupuncture, is based on palpation. So it's not on where the anatomical point is, but it's what is felt under your fingers that's important. So we have the anatomical point, and then we're looking for the live point as well. And I taught point location and was module leader at University of Westminster for a very long time. And when I came to Toyohari, I kind of went back to being a complete beginner and felt completely de-skilled to begin with, because actually finding the live point is not as easy as finding the anatomical point. The anatomical point is just the starting point. It's like being given the address, and then you have to kind of go and, as one of our teachers said, then you have to actually go and find the house, the road, the house, and the front door in order to make sure that you're in the right place. So what I'd like you to do, just to break it up a little bit, then I'm going to do a demonstration as well about the kike, is I'd like you to, again, just stroke down each other's, in fact, I'd like you to do it in a group of 3 if you can. It may not be that easy to do, but I want you to, one person to stroke very, very lightly down the lung meridian, only really from about lung 7 down towards lung 9. And I'd like the other person to just feel the pulse. So this is kind of a lot of what we do in a more sort of detailed way, but I'd like one person to very, very lightly, as I said, just as if almost feather-light, so you're hardly even touching the skin, stroke down, and I want the other person to feel the person who's being stroked to feel their pulse. So it works in a group of 3. One person strokes and the other person feels the pulse. So just do that for a couple of minutes. Just feel all the pulses, and don't try and make any diagnosis, or just keep it simple and just see, do you notice anything changing? So you're very lightly stroking down. You're not going to have too long to do this, because I realized we're already at 25 to 1. I've got a lot to cover. But just for a couple of minutes, just feel the pulse with your 3 fingers on the 3 different pulse positions. Press down a little bit so that you can feel all the pulses, and the other person just very lightly stroke down, ideally with 1 finger, just the index finger, very lightly stroking, and see what you can feel. We're just looking to see whether you notice any changes, even just from very light. So we stroke, I'll show you what it looks like. Kind of just stroke like this, 1 finger and the other finger supporting. Incredibly light. Just like this. Stroke with the edge of the index. So I'm not asking you to make any diagnosis, just observe if you feel anything changing. Make sure you're stroking with the meridian flow, not against it. So from lung 7, yeah? So if you were doing it, you're just stroking down this one. Very, very lightly. And you could try going against the channel flow and see how that feels. May change. And if you're brave, you could very lightly stroke against the channel flow and see if you notice a difference. Okay, I'm going to slowly have to get you to stop. Again, it's just a little bit of a taster. I don't want you to also over-stimulate all the meridians. So, going back, if I could get your attention again, my little bell that I don't have. So, when we're working within Toyohari, as I said, we're trying to kind of work out what it is we're feeling, what it is that's going on with the patient's chi. And the most important thing it kind of says in the classics, if I can have your attention, it's great, nobody wants to stop. I love it. I can assure you that when you're working on the Toyohari program, you have a lot of time to practice, so much more than I'm giving you now. So if you have a look at things like Ling Shu Chapter 1, the emphasis is always on, in order for anything to happen, qi has to arrive at a point. And of course, the question is, how do we know that qi's arrived? Or how do we know that we can have an effect? This is where it starts to get a little bit sort of into just different words and different kind of interpretations that he brought, and there are lots of different kind of opinions on all this. But the two key things are about arrival of qi and obtaining qi. And certainly if you're doing TCM, then we talk a lot about de qi and that kind of feeling. But we're talking about that as often something that the patient feels rather than the practitioner feels. And Ling Shu Chapter 1 particularly emphasizes the qi shi, the arrival of qi. I mean, that's like a nice kind of poetic image. When we're needling, we're looking to feel something changing at the pulse. So I'm needling, but somebody else is feeling the pulse and giving me feedback about the changes that are happening. So that's already kind of quite an interesting concept, because you've always got this third person who's giving you feedback whilst you're on the point. The emphasis, as I say, the de qi is mentioned in the Neijing as something that should happen, but not necessarily with reference to who is feeling it. And then, as I say, qi shi is much more evident as emphasizing that it's actually something that the person who's needling feels. So this, you might have heard this quote, the superior physician feels the qi with their left hand. So when we're doing Toyohari, we're using the left hand to support the needle, and that's where we're feeling changes. That's where the qi is gathering. That's where we're feeling kind of changes at the needle tip. So we're feeling that with the left hand, and the right hand is the hand that's supporting the needle and advancing the needle to the point. So when you are doing that very light needless stroking, you're kind of actually bringing the qi to the point. Yeah, you're very lightly stroking down the meridian, and you're trying to look for where the actively alive point is. And it's only once you've felt something happening at that point that you then start to do needling. So when we're doing our practice sessions, the first thing we do is actually look for where the alive point is. And the person who's going to needle strokes down the meridian towards the point, whichever the point is we're needling, and the other teacher or other peer people in the group are feeling the pulse of the patient, like you were just now, and giving feedback about, oh yes, that's where the pulse has changed. Or actually, no, the pulse is still hard. You're either not on the meridian, or you're pressing too hard, or you're certainly not on the point. And then when you bring about a nice pulse change, some kind of improvement in the pulse, then you know that you're actually even beginning and ready to needle. So, as I said, a lot of how we needle is based on classics. So, as I said, this idea of preparing the point, drawing the qi to the point. As soon as qi arrives, that's when you're ready to actually start needling. We're always, if we're doing tonification, you have to go with the channel flow. If you go against the channel flow, you're going to get a negative pulse change, because you're tonifying, so you want to go with channel flow. So even that, you know, a lot of these things I now take for granted, but even that thing of, if I stroke with the lung channel and the pulse improves, and I stroke against the lung channel and the pulse hardens, that's telling you something about qi flow. Yeah, we know all this stuff in theory, that the lung meridian travels down out toward, it travels down basically to, you know, from the chest down to the thumb. But actually, if you stroke a meridian and you see a pulse change, negative or positive, that's reinforcing what we know to be theoretically the case. So even that's kind of, you know, I forget that things like that are kind of quite interesting. So we're advancing slowly because we're tonifying. We're aiming to make contact with the qi. And we draw quickly, because when we want to withdraw the needle, we've built up this qi, and we want to make sure that we seal it into the point, so we're not actually going to lose or leak that qi. So these are all quotes from Ling Shu, that you advance slowly and you withdraw quickly, and the opposite is true for a dispersion technique. And there are lots of references also to shallow or non-insertive needling. And we close the hole, this idea that you have to kind of obstruct the gate, make sure that you seal in everything that you've gathered at the point. So just a few other things. This idea of awareness, a lot of what we're doing actually ends up being really kind of quite meditative. I mean, I always find actually at the end of my treatment sessions, I'm almost, well, I'm actually quite energized rather than exhausted, because you have to pay so much attention to being in a good posture, because even that can affect the pulse. And there's a kind of awareness, mindfulness in terms of your practice. But getting the timing right is what these are talked about. And it's all about repetition. So we're talking about these very not so simple techniques, but over the years we're learning all the time about how to kind of improve on the on our techniques. So when we work with our blind practitioners who can't see what we're doing and we're starting to needle, it may be that they feel that the pulse is getting harder, and they say, relax your left shoulder, or, you know, your neck is tight, or, you know, you're not standing in the right position. And they're picking this up from what they're feeling on the pulse of the patient I'm about to needle. So that's the kind of subtlety of the kind of techniques. And you, if you're standing like that, and the pulse will be harder, if you then bring your body into a better position, the pulse softens of the patient you're about to needle. So you have a big influence on those kind of things on a very subtle level. So I mentioned these earlier. Kike, I was going to do a little demonstration. I'm going to actually just whiz through very quickly the next bit, and then I'll do the demonstration so we don't run out of time. So just very simply, again, it's like we're putting a piece of zinc and we're putting a piece of copper on the skin. They have a polarity difference. One is positive, copper is positive to zinc that's negative. And we're looking for symptoms to change, and we're looking for pulse to change. All right? We use these on the extra vessel meridians and extra ones for the ones that aren't included in those 8 patterns. And basically, we look for the pulse to change and we look for symptoms to change. So that's kind of quite mind-blowing. Put a little piece of metal on the skin and you're expecting something to change. I worked recently with somebody who's pregnant. She had vulval varicosities, liver 3, heart 5, which are 2 of the ones that aren't in the 8 extra vessel. That was the pattern I used, as well as doing always with root treatment. Big difference. Obviously they didn't completely go away, but as she got heavier and heavier, her symptoms didn't get worse and actually improved, and she wasn't in pain. And somebody recently, again, temporomandibular joint dysfunction. In fact, she wasn't coming for that. She was coming for fertility. But she said, I've got this kind of chronic thing. I can hardly even open my mouth to eat an apple. And so as part of the treatment, I thought, okay, that where I identified the main meridians were involved, triple burner, gallbladder 41, popped the things on, and she went from here to like that. So that was kind of exciting and interesting when those things happen. So, quick case, a patient who I treated originally for fertility, and then she came for pregnancy. Got pregnant quite quickly. She was younger, in her 30s, and that was all fine. But then developed these kind of quite severe pains in the middle part of her pregnancy, which they thought originally were kidney stones. Turned out to be this condition I'd never heard of before called hydronephrosis. As I said, always treated her with root treatment, but started off by doing extra vessel points. Originally, I was doing the G clef points rather than the main points because there was a lot of pain. And then also other times, gallbladder 41, triple burner 5, because it was around the ASIS hip area and things like that. And I presented this case at our acupuncture childbirth team group, and a consultant who happened to be there, which was a bit scary, presenting in front of him, said, well, actually that condition doesn't really go away till baby's born, but actually through treatment she was able to really, it kind of went down to really quite manageable levels and sometimes no pain at all, and Kike was kind of quite key within that, I think. So just I'm actually, we'll go through this. Shigo treatment basically is another way of influencing, let me just, the meridians through using that polar channel pair. So just very briefly, if you've got an acute condition rather than a chronic one, and say it's on gallbladder meridian, like a sciatic problem, we would needle with a gold needle, non-insertive needling, on the low point of the corresponding meridian on the other side. So if it's gallbladder, do we know what the polarity opposite is on your 24-hour cycle, midday, midnight? 11 to 1, heart. So I needled heart. And actually I had a fall, a really bad fall a few weeks ago, and it was all down on my left side, and I was really in shock, and I thought, well, actually I'm just going to do the Shigo point on myself on heart 5, and it was really interesting because I just went, and actually completely, all that kind of shock suddenly felt like it kind of left my body. So this isn't going to work, okay. So this was supposed to be a couple of videos, but classically that's not working. So Kosato, as I said, the main things about it is that we're constantly giving feedback and we're constantly getting feedback, and that was kind of key to what Kosato, one of the key founders of Toyohari, did. He kind of introduced this idea that we're constantly studying together. So I'll leave that up there for the moment. These were just some of the things that, again, my colleagues said about why they decided to study and how they felt that it's kind of helped them in terms of developing their sort of sensitivity. I would like to just do a very quick demonstration. That's me with Yanagishita Sensei, our previous president, blind, giving me feedback whilst I'm needling. So he's feeling the pulse of the patient, I'm needling, and he's telling me what he's finding. And that's me just even starting doing point location. So again, a few more quotes. Who's got a condition that actually you can feel something with movement, some sort of actual, like either a pain or restriction of movement or something? You've got frozen shoulder, so that doesn't move at all, okay. The other thing is it would be helpful if it was on something not, because often there are lots of meridians involved. So oh, okay, so that was a more that's a more acute thing. Okay, so this is used more for chronic problems rather than acute. The Shigo would be good for that. But one other. Okay, and is it on a particular? Is it? Can you feel it with movement? Is there particular movement? Okay, so do you want to come up, because I'm just thinking of something that's maybe on one particular meridian rather than two. So what we do when we're doing a Shigo treatment is the extravessel Kike treatment is that we are basically placing, I need you to take shoes and socks off. So we first of all identify which are the meridians that are involved. As it turns out, if it's on the back, then which channel pair, if we were talking about extravessels, would be think about using? Yeah, so which channel pair? Yang, what we call the Yang Chao Du Mai pair. So small intestine 3, bladder 62. Obviously, if you're doing a whole treatment, you're actually doing, as I say, a root treatment, and then this would be kind of part of it. So can you take your watch off and other metals? So this is what they look like. Piece of zinc, piece of copper. So can I get you to put this in on your back? No, that's fine. And the main treatment, yeah. So as I say, so is there a particular movement that you could do where you would feel it or not?
Yeah, normally even just because I want to learn it, just that, or if I want to turn.
And it's on the actual, obviously I would do the exam.
Yeah.
And it's mainly on the left side.
Now it is.
So as I say, this would be part of a whole kind of group treatment as well. But the first thing what one does is actually, if you're doing the Kike anyway, you're still looking to see how does the pulse feel. Do you want the pulse to change? I know pulses feel quite good, but there's a little bit of hardness in the pulse, and they're very, very slightly kind of close. So what we do is we're looking for, can you hear me if I'm not using the, I can't speak on the microphone around it, is that we put, the general default is that we put the copper point on the area of the body where the problem is. So because this is on the lower part of the body, we use the master point that's on the lower part of the body, so it's bladder 62. And we usually go to the side, keeping it simple, where the sort of symptoms are. So what I'm going to do is I'm going to look for a slight reaction, and you tell me if I can feel it on just around the center. There. So I'm looking around the bladder 62 area. Somebody else actually may want to kind of feel the pulse on that side, just to make something up. I'm placing that copper there, and then I'm coming back and I just want to see. So the pulse has lost a little bit of that hardness, it's slightly softened. So then I think, okay, that's already positive change. So I'm going to come and look. Small intestine 3 isn't necessarily always tender. Tell me if there's a little tenderness around there. Yes, yeah. Okay. And then I paste the zinc pellet. It's softened and sunk. Yeah? So just putting a piece of copper and zinc, polarity agent, on bladder 62, small intestine 3 has already improved the pulse. It's sunk a little bit, it's softened, that hardness is relaxed on the pulse. What you do is you leave this on usually for about 2-3 minutes, and then you reinforce the treatment with moxa. So you do 5 on the master point, 3 on the copper point. So just, what was the movement?
It's even, yeah. You can just pulling the legs up there.
Okay. And just tell me if you feel the legs up now, if it's the same, or if you feel any different.
A little better. Still sore, but definitely not as sore.
So the zinc and copper is partly treatment, but partly diagnosis. And because we use it for chronic conditions, that's why we use the moxa, because moxa has an effect of working on the blood level when things are becoming more chronic. So what I would be doing now, which I'm happy to do, and also I can answer some questions in the meantime, is I will do a little bit of direct moxa on the point if it's not acceptable. So, any questions? Because I'm aware that we're coming up to time. Yes?
I see you're using just the one side there?
I'm using just the one side because, well, actually, because I'm running short of time, what I could have done, because actually you said at the moment it's on the left, if it was a more dual-sided problem, or maybe like a cough that isn't necessarily on one side, then I would compare left and right.
But you wouldn't do...
And I might do contralateral in a situation like that. Yeah. I mean, as I say, I was a little bit short of time, which is why I focused on that. So we take the couple point off first. I'm just going to make a little mark there, and then I'm going to do bladder 62. Needless to say, in Japanese acupuncture, the location of the points is slightly different as well. And some points. Any other questions? 5 minutes. We've got 5 minutes.
So, do you feel that the needle is encouraging the arrival of chi?
Well, that's how we're assessing that something's changing by what's changing on the pulse. So that's kind of, even though we're not inserting needles, actually what we're doing with the needles is completely affecting and influencing. Is that your question?
So, is the needle mechanism is making the arrival of chi?
Yes, because that's how you're working out, for example, what's changing on the,
It's in the
how
right
you
place.
know what's changing on the pulse. So what we do is this is rice grain moxa that I'm putting on.
So you're going to burn the skin a little bit?
And I'm not burning it, but I'm just so that you feel a little bit of heat. They're half rice grain pieces of moxa. So the person's supposed to feel a little bit, but hopefully not to the extent that they're jumping off the tape. But the moxa is the one that's working more at the blood level, so that's why for more chronic treatment, that's what we do.
forget before the end, Merlin is going to be standing with a board. If anybody, you've got some information about the Toyohari program in your packs. If anyone wants to receive more information as well, you can put your name down on the piece of paper and we'll send it to you. As I said, we're running the first Toyohari program in the UK starting in January.
Any chance something coming to America?
There are in
We
America.
have
There's lots of courses in
Toyohari.
America. Yeah, all the different parts. There's some in
They're not in colleges
Florida.
though. It's all
They're not in
private
college.
instruction.
You have any-
Yeah.
I'm
Toyohari
not sure in New
Society.
York.
Yeah, I kind of got in touch with that. But, yeah. But it's all
Because
private
Stephen
programs.
originally lived in America, so actually he created the
Nigel's
North
program,
American
you know,
program.
Japanese, yeah. But it's all private instruction.
So I hope that I've kind of just given you a little bit of a taster of what of how kind of Toyohari works, some of the magic of what we do. Oh really? Okay. So this lady, Caroline, just said that she feels a lot of heat in her lower back. Okay, so I've worked ladder 62. Lift your leg up for me again, see how that feels. So she's saying it feels a lot better. I wouldn't be, if somebody came into my clinic, I actually often start with PK if I'm going to use it, because sometimes you put the zinc and copper on and actually it doesn't improve the pulse, and then you might swap the polarity, and that's the better way round. So for example, even if you've got a headache and you start off with Sanjiao 5 because it's on the upper parts of the body, it may be that actually you switch the polarity because it's on the gallbladder meridian and it responds better to the copper. So because I'm playing around with the pulse and the pulse might improve, if I've done a good root treatment, I don't want to ruin that, so then I might start. But in a situation like this, I'm not going to only then send somebody home with this. I would then do a full root treatment based on all those diagnoses. But Caroline's saying that she feels this heat in her back, and lifting that leg up, it feels a lot better too. So I'm just I'm not doing magic, but it is kind of magic, because it's like, wow, how can we change the pulse? How can we bring about all these changes just from a little piece of copper and a little piece of zinc that's on the skin surface?
And that magnets